Hi, everyone. This is Joseph Dorelien here bringing you episode 5 of the Next Level series. What we do in this series is bring business people on the show and have them talk about their organizations as well as featuring those from the nonprofit sector on the show. The business people we meet are unique, creative, innovative, great, and our goal is to showcase their business to you. Today, we're going to meet Anna-Marie Dorelien, the clinical director who is also a board certified behavior analyst at a Friendly Face Autism Treatment Services, which is an organization that specializes in enhancing the quality of life for children and teens who are on the autism spectrum disorder, one of the most prevalent and present disabilities in the United States. Its clinical staff consists of registered behavior therapists, board certified assistant behavior analysts, and board certified behavior analysts. This organization has 5 locations throughout New York and New Jersey, as well as in South Florida. So here's to introduce to you Anna-Marie Dorelien. Hi, Anna.
Hi, Joe. Thanks for having me.
Thank you for being on the show. So please tell us how your organization got established.
Well, I prior to A Friendly Face, I was running a school for children with autism and typical kids, an integrated school. And in that school, I was meeting a lot of families who were trying to get their children with autism in activities outside of the school setting, like trying to get them into sports or music or even yoga, and like situations where they could be with other peers. But often those families found themselves being kicked out by whatever groups they've joined or leaving altogether because they weren't getting the appropriate support. So that's where A Friendly Face Autism Center really came into vision for me. I thought I wanted a place where children can come in and they can access all these different activities, and we would work on social skills and whatever deficits they may have to prepare them in these environments where they would be more successful in those settings.
So what made you come up with the branding of A Friendly Face? The name, the logo, the branding?
Oh, that whole thing. So, children with autism are often, I think, wrongly branded as kids who don't want to have friends, or kids with no affect, or you can't see an emotion on their face. So I thought, well, this is a place that you can see that kids are friendly according to just the emotional response that they have in their expression. And this is a place where they can have friends. And so, of course, going with that, A Friendly Face, I wanted to draw a face. And I wanted to make sure that it's just a smiling face, and perhaps something that can be drawn by a preschooler. So one of our BCBAs, actually, I was at her kitchen table and I said, can you draw something in the painting, I guess a paint brush part of a computer? And I'm like, just scribble something that looks like it could be a child drawing a smiley face. And that's how we came up with A Friendly Face and the face that goes with it.
Wow, that's incredible. How
cute, right? Because now everyone refers to it as AFF, but that's how it began at someone's kitchen table up in Queens.
Simple, but yet sending a strong message, which is extremely important.
Yeah, absolutely.
Yours, you want to send that message to parents. You want to drive that home. And so I want you to tell us more about your organization. Please elaborate on what your organization's about, those aspects.
Okay, so A Friendly Face, we provide applied behavior analysis therapy for children diagnosed with autism. So for you to come into our centers and access the therapy, you already have to have an autism diagnosis. And what we do is we provide ABA therapy, which is covered by insurance, most insurance. and it's based on the science of behavior, where using the science of learning, you can increase the skills of everybody really, but specifically children with autism, increasing verbal behavior, increasing social skills, abilities, self-help skills, play skills, being able to regulate, decreasing impulsive behaviors and all of that stuff, learning how to make friends. So we use ABA therapy to help them to get there. So we work in the home in a structured setting and have the parents like there with us and watching therapy. Some of our kids come to the center immediately after school. They're dropped off by the school bus. And then what we're known for is really our weekend social skills that run for about 3 hours. So whatever we are working on in a structured setting at home, we set up these little environments so that they can practice these skills in a bigger setting. So let's say, for example, Joe, let's say little Brian is learning how to say hello, right? Some kids with autism, they might not have the skill where if someone says, "Hi, Joe," they know to say, "Hi, Miss Mary," or "Hi, Samantha," or something. They might not know how to respond in that way. And in a structured setting, we might work on that. And then in the social skills on the weekend, we literally have other peers coming up to them going, "Hi, Joe," and they know to say, "Hi, Timmy," "Hi, Samantha," "Hi, Michelle." So we work in that. And we have yoga, we have sports, we have arts, we have social skills. We've got all kinds of little activities that run for about 15 minutes. And the kids participate in those things with the absolute goal to learn how to socially interact with their friends and their peers.
So what do those activities do in the benefit? Obviously the social skills aspect, what else do they do in terms of benefiting the children and the...
So, sometimes, well, more often than not, children on the spectrum may have issues transitioning, going from one activity to the next, especially an activity that they like. They kind of just want to stay doing what they want to do and they can't move on to another activity. So they learn that this is only a certain amount of time. Now we're going to transition, and they learn to regulate and not to be so frustrated when settings change. They also learn to, tolerate all that sensory input. Some of our kids with autism, they really can't tolerate a lot of noise. And we teach them sort of like to learn to tolerate increasing stimuli. Because the truth is, we can't hide our kids in the home. We can't hide them in safe spaces. They're going to be out there in public. They're going to be taking public transportation someday as they get older. And there's all this bombardment of stimuli, and we kind of teach them to regulate through that. They follow directions, they say hello, they talk to each other, they learn all these different skills.
That's so important. And what you folks do is basically provide an integration of social skills, and at the same time, real life, providing real life scenarios with those.
Absolutely.
In that aspect.
Absolutely.
So that's really a holistic approach, I say.
Yep. Absolutely.
So I want to ask you a question.
Sure.
How many BCBAs, BCBAAs, and or BCABAs basically, and how many of those people do you have in your organization? How many of those members do you have in your organization working with you guys?
We're very, you know this about us, we're sort of like a boutique company. We can expand exponentially if we want to. I think.
Well, you already have 5 locations.
Yeah. We have a little over 20, and a BCBA can handle about 10 to 15 cases, maximum. So we have enough to ensure that we have quality services. we're also very much about getting the kids the help that they need and graduating out. So we're not about keeping kids and keeping cases. We're about really making sure that our kids are optimal as soon as possible because there's a long wait list. We want to make sure that it's more a personal thing than just running a business, really. I mean, I have a child on the spectrum, and our administrative director has a child on the spectrum. So I think our goal may be more personal than maybe other places where, they're more probably expansion driven, even though we do have all these locations. And the reason for those locations is so that all our kids everywhere can access the center and all the social skills that we provide, activities.
So what makes your organization unique and different from others in the industry?
Well, we are unique in that's the very reason why we're unique, is because we have the centers where we set up and contrive these different settings. That's unusual in other ABA agencies. Like, I was talking to a doctor not so long ago, and she knows about ABA, and we're collaborating on a project. And she was like, wait, you provide yoga? How does that work with ABA? And I told her all of our supervisors, all of our group activity leaders are trained in ABA and are trained in working with children with autism. And they're literally targeting, like, for example, in yoga, they're targeting imitation in language. They're targeting, following directions in a group. Like, they're literally working on skills. But now it looks like yoga without them realizing that they're actually applying the skills that they learned in a more structured way. So that's what makes us different, is that we have yoga, we have music, we have sports, we have all these different activities that you would never find you wouldn't really find in your classic average ABA agency. We're really all about generalizing these skills and making it as naturalistic as possible.
That's amazing.
Yeah.
It works. So I remember putting this on the website, but I remember seeing this, you have so many services, your organization. Yeah. You have a voluminous amount of services, I say. Yeah. And discuss the services that your organization provides. Tell us about all of your services.
So we just provide ABA therapy, but what we do is we provide parent training. We also have a lot of interns that come through. We work closely with universities. So we want to make sure, like, I like to hire from within. I want to make sure that the clinicians that end up working for A Friendly Face are really passionate about the kids. So we have parent training, we have parent support group, we work collaboratively with mental health counselors to provide that also for our kids. We work with schools, we work with speech therapists, OT, neurologists, just to make sure that the treatment for our kids is really well-rounded. And yeah, the services we provide is home, out in the field, and also at the centers.
That's incredible. So the home services, so talk about the home services, talk about these aspects of fields of the home, those services, individually.
Yeah. So typically when I meet with parents and they ask me what I recommend, I say I recommend a setting across, 3 that we provide. That I recommend that you have home services, that you have maybe 2 days a week at clinic-based after school, and you certainly go in for 1 session on the weekend, because we're talking about generalizing those skills. So in the homes, typically the therapists come in after school because the kids are in school, right? Most of our kids are in school, unless there's issues where the schools can't have them. And we've had situations like that where they're sort of intense cases and the schools can't handle them. And so So then we work with them at the center. But for the most part, we go after school at home, and we work on certain skills in the home. Parents usually have it set up either in the basement or in the living room, table and chair. And the therapist would typically maybe sit in that table and chair with the student for half an hour, then maybe go around the house for the next half hour working on language and interacting with family members, and then maybe sit on the rug and do some play skills, and then maybe end the day back at that table. So home therapy looks like that. Clinic-based setting, when they get off the bus, I mean, they have their assigned therapy rooms. And again, it looks like that. Like, half hour they might be at the table, the next half hour they might be in the main space interacting with the other peers, playing, and that kind of thing. Yeah.
So what message do you want to send to the public? What do you want to send home to parents and to the students? What message do you want to send home?
That there is hope. That there is hope. That having a child with autism, that there is hope for improvement. That there are therapies that work in terms of increasing skills. I've dealt with so many parents, because I've been in this for so long, and sometimes you meet parents who are understandably shocked by the diagnosis because they don't understand. They might be going through some denial, some sense of guilt, depending on your culture. There's shame that can come with it. And the message that we really send at a friendly face, our motto is where everyone can be the best version of themselves, right? That's our motto. So really, this message that having a child with autism can be a gift, because some of our kids on the spectrum are the brightest, sharpest, most witty kids. My son, I wouldn't want him any other way. Joe, I mean, you wouldn't want to be any other way, because you're just amazing how your brain works.
Thank you. I appreciate
so like this message that children with autism are amazing. They have great potential. They can learn. They are a crucial part of our society, and we just need to support them because they learn differently. And because they learn differently, we need to teach them differently, and they will thrive and do really well.
So what makes people choose your organization? Talk about that.
What makes them use our organization? Well, I mean, usually most of our parents come through recommendation. Either they're recommended by other parents, recommended by therapists, or a lot of our kids are recommended by doctors and neurologists who will say to their parents, this is my number one choice to send you to this agency. And I think they recommend us, first of all, because it doesn't take very long once you get in to AFF to see that everybody there is truly passionate about what they do. They really care about the kids. And I think it's important to know that you're supported. I think for a lot of parents too, it's comforting to know that there are owners in the company where your child's diagnosis resonates. That we know where you're coming from. And we are about a quality, and we are a company that truly cares. And across the board, Joe, I mean, if you work for us as a behavior tech and we see a potential in you, we will push you and guide you and support you to become a clinician someday. We have clinicians that used to be behavior techs and that moved along, the ladder, because we saw a genuine passion in them, that they really cared, and they're smart and they're dedicated, and we will hone in those people, and we want them to stay in our tribe. So at a friendly face, absolutely. And then we have parents that want to really participate in terms of can we help other parents. So it's just that environment. I've had a lot of staff members tell me that a Friendly Face is the first place they've worked for where they absolutely love coming to work. And you know, what we do isn't easy work. What we do is not easy work.
I've
And
seen firsthand.
yeah, it's not. It's tough all around sometimes, and you've got days that where you're down and days that are just victorious. But a lot of staff will say that it's probably the best place they've worked for. So I think then that makes us a place that a lot of people choose to go to.
So I want to ask you a very important question here.
Sure.
What are your long-term and your short-term goals of the organization? Talk about that.
Well, short-term goal right now is to get back to normal because of COVID. So short-term goal right now is, can we get back in the homes? Can we get back to opening our centers?
So that'll happen soon, very soon.
Yeah, so phase 2 opens on Monday. Obviously, that doesn't mean that we are open on Monday. We are hopefully trying to open the center in a very soft opening type of way. There are a lot of guidelines, Joe, by CDC and Department of Health, as you can imagine, for small businesses. And you're talking to small business owners and business owners.
Small business owners every hour of every day, pretty much.
There's all these guidelines in terms of us opening. So we have our soft opening on June 29th. All of our, as far as like our offices at least, and maybe letting just a couple of our kids come in and see how it looks like when we implement all these new regulations. So that's our short-term goal, is to just get back to normal. We have so many families who are not receiving help right now because of what's going on, and our families are desperate. Our long-term goal, we're also involved in projects where we provide training and help. Right now, in other countries, like right now on Saturdays, I do free Instagram live trainings for parents in Brazil, and teachers and therapists and doctors attend. And there's hundreds and hundreds of viewers on Saturdays. So long term is to be able to help more people, hopefully open more centers everywhere, as long as the integrity and the quality and the standards remain the same. Joe, I am not about getting big and losing quality. We can be so much bigger, because it's unfortunately a field where you can get super big. And a lot of agencies out there get super big overnight, but that's not what motivates me. That's not what moves us in terms of expansion. It's really like, will we be able to make really long-lasting impact? And we can only do that if our staff is trained, if we've got great clinicians. And if we can do that, I would love to open more centers, one center at least per borough, and in more places, if we can get our quality the same in every place.
And that's a very hard thing to accomplish, but I believe your organization can do that, though.
Thank you, Joe.
Your organization's track record of being able to get things done and get them done right. And making so many parents happy about what you folks have done in that aspect. And I tremendously respect, your work. I respect what you've done for people. I respect what you have, accomplished, especially for children, and enhancing their quality of life.
Thank you.
It's not too often that you hear of an organization that really enhances their quality of life down to the T and down to perfection. But your organization definitely does that, and definitely epitomizes that in so many ways.
Thank you.
Where it's really,
try.
Well, you deliver. You deliver, because there are countless parents, countless children, countless young people who engage your organization, and they truly get a lot of benefits out of it. Yeah. That speaks volumes.
Yes.
It really, you have so many prolific accomplishments, and not too many organizations can say that. Not too many of them could say that they have accomplished as much as your organization has.
Right.
So you should be very proud and honored by the work that you've done.
Thank you, Joe. Appreciate it.
Thank you. It was really great having you on the show today.
Thank you for having me.
Well, thank you for participating. Thank you for being part of the show.
Thank you, Joe.
It was a great interview.
Thank you so much.
And I hope that as many parents as possible hear our interview and see what we have spoken about today, and see what you have elaborated on with respect to your organization.
Thank you.
Thank you.
Appreciate it. So we're done?
We are going to wrap up the interview right now, and that is it for today's episode of the Next Level series. And subscribe to the YouTube channel and visit AFF Autism, informally speaking, Friendly Face Autism Treatment Services at www.affautism.com, and follow the organization on Facebook, Instagram, and Twitter, and all over social media. And thank you so much for being on the show again.
Thank you, Joe. Bye-bye.
Bye-bye.